Hi there, Dr. Kerry Yerkew here. I'm a chiropractor in Kelowna, British Columbia. Today I'm talking about TMJ disorders. It's something I see often in the clinic, and I just want to go over the chiropractic approach to TMJ. So TMJ is known as the temporomandibular joint. The short form is TMJ. So the temporomandibular joint, that's the joint between these two bones. And inside that joint, there's a condyle, kind of a curve or a cup, and then the bone comes in. There's a disc that prevents the bones from rubbing against each other, some fluid in there, and then there's actually some ligament that attaches to the muscles in the cheek, like the masseter muscles and the temporalis muscle here on the side of the head. So there's muscular contractions, the ligaments and the disc pull on the ligaments and the tendons pull on the joint, and then the joint slides out. Now it needs to slide out symmetrically, so kind of slide down, and so you can open your mouth and close it and chew. Sometimes you want to move your jaw right to left, but if you have misalignments, if the disc is getting caught, there can be jaw pain. It can restrict the mobility of the jaw. It can also cause clicking. And that's very common when the disc gets stuck between the bones. So as a chiropractor, what we want to do is adjust the TMJ joint. We do that using an instrument or by hand. I prefer the instrument called an activator. And by adjusting the TMJ, the goal is to realign the joint so that the structures like the disc are back in the proper place. That allows the jaw to open and close properly. It minimizes or gets rid of clicking. It will help the jaw to move side to side and open and close properly. The last thing I check for patients when they come in is biting down. I want them to bite fairly hard to make sure there's no pain when there's pressure put on the TMJ joint. Now sometimes also posture is going to be important, and I'll show you what I mean in one sec here. Now posture is so important because if your head's not being carried properly, let's say you're slouching, your back's rounding, your head's forward, and your head is at a downward angle, it's going to change the angle of the jaw. So no longer will the jaw be opening and closing properly, but it's going to be compressed or opening and closing on the front part of the joint because of the head being forward. If it's in reverse, it's going to be compressing and sliding on the back part of the joint more so than the front part. So you could have TMJ problems because of misalignments in the head and neck region, the posture right here. So not only do we want to adjust the jaw joint, but we want to check the posture, because if there's misalignments, we want to adjust that as well to correct the cause of the problem. Now, if you're looking for a chiropractor in the Kelowna area, we are accepting new patients. No doctor referrals needed. We bill directly to insurance. You can click on the link below or call the number. We'd be happy to help you here. We're open 7 days a week. We're in Kelowna, British Columbia. If you're not in the area, you can leave a comment below or DM me. I'd be happy to refer you to a chiropractor in your area. The last thing is we're getting closer and closer to 500 subscribers on YouTube. If you can subscribe to our channel and like this video, it'll just help our channel out to do more videos like this, and I will talk to you soon.